I would now like to turn the conference over to your host, Dave Regan. Please go ahead.
Thank you, and good evening, everybody. Thanks for making time the night before Halloween to check in about, really what is a long-standing project of the union with regard to the California Hospital Association. So what we want to accomplish here tonight is I want to take, maybe 15 minutes or so to try to walk people through the status of our discussions with the California Hospital Association, some important deadlines that are coming up. So with that, I'll just recap very briefly as, everyone on this call knows that a little over, almost now exactly 2.5 years ago, we began a process with the California hospital industry. It led to the signing of an initial strategic agreement between UHW and the industry. It foreshadowed a desire on our part to create an entirely new relationship with hospitals in California to ultimately end up in a place where we could have as many as 100,000 non-union workers with the opportunity to join our union without their employers campaigning against it, an innovative contract agreement and the potential of a multi-employer agreement across the state of Ohio, or the state of California, excuse me. And I think it's fair to say that we've had a series of discussions, both collectively with the leadership of the industry, with individual system and facility leaders. Some have been in groups, some have been individually, but I think there's three basic pieces of, what we've been trying to get our arms around. And the first one, not surprisingly, the notion that the union wanted a new relationship with the industry, that we were looking at, how could we structure it, what would be the role of the hospital association since it doesn't actually employ any hospital workers, what would be the role of the individual systems and facilities, all of these things had to be broached. And the participants in the conversation on the industry side raised a whole host of, potential legal issues, including concerns around, antitrust issues and whatnot. And as of today, I think, we have successfully addressed all of the legal questions associated with building a new relationship, a new model, a new paradigm for unionization in the California hospital industry. The second group of issues really had to do with, could there even be a way where you could make a business case that made sense to the leadership of the industry, who comes into the conversation, with a very traditional view that getting the union, just means a significant increase in costs. It doesn't help you operate any better. It doesn't give you any strategic advantages. And so what's the business case? And both we and the Hospital Association jointly hired a top-flight management consulting firm to really, try to do the analysis, to think, deeply and comprehensively about, if we don't think about this in the way things have historically been done in one institution or one system, but if we really look at it as an industry, does it allow us to have a different sort of business case to be made? And again, I think all of that, frankly, surprised people, and I'm happy to report that I think one of the things we've accomplished is that we have now demonstrated, really, with validation from from a group that's very highly regarded by the industry itself, that the union can in fact function as a strategic partner, that whether you think about political advocacy, whether you think about joint purchasing, all of those kinds of things, that there's an interesting and formidable business case to be made. And then the third thing, not surprisingly, was our insistence that part of building a new relationship meant that there had to be a new way for non-union hospital workers to join the union, and that we were seeking, as part of a new relationship, an across-the-board understanding for how workers would be able to vote in elections without employers running traditional anti-union campaigns. So I think those three categories of thinking, in terms of we've successfully answered a whole host of legal questions, we've successfully answered a whole host of economic or business side questions, and then the third thing, not surprisingly, is people are not ready to jump to the other side of the line on the question of a different path to unionization. So that's the background, that's the context. We've discussed all of this before, and let me also say that although this is obviously something where we focused on the hospital industry, that this is very much a starting place, and we think it makes the most sense to begin with the California hospital industry. But ultimately, we think we have to look at medical offices. We think we have to look at long-term care, including how do we incorporate home care and nursing home care, in a similar sort of, paradigm change. And given the base of our hospital workers and the strength that we really have in the union, that was always our thinking. Is it's a launching point, not an end destination. And so I think with all of that, where we sit today is we're really at a fork in the road. And in addition to those mechanics of the conversation, I want to emphasize again that we as an organization, SEIU-UHW, is saying to the California Hospital Association, and sort of by extension to the other parts of the healthcare delivery system in California, that we are very serious about a core set of principles, that we are going to continue to insist that the quality of healthcare in California be improved, and whether that's through hospitals, home care, nursing homes. We want to be an organization, again, that's a premier healthcare organization that speaks to the common good in terms of the need to improve quality. So that's one core principle. Second core principle is healthcare is too expensive. It's too much of an economic burden for too many workers, too many families, too many employers, particularly small employers. And at the same time that we have to be committed to raising quality, we have to lower cost. And there are ways to do that that are not low-road strategies that seek to cut the wages and benefits of healthcare workers. So that was the second thing. And the third thing, is again high-road labor relations, and how do we think about that? So we've really said to the industry, we want to build a new relationship with you. We are very serious about raising quality and lowering cost. And there is one of two ways we can go about this. We can either go about this, in partnership, in collaboration, where we build a new paradigm, where workers can join the union, where the union members understand that we, need to be a workforce that's providing high quality, more affordable care, that we have to do things like Let's Get Healthy California, Total Health. We have to be model consumers. But everything we look at, it has to pass the test of, is it in the common good for families, for communities, for the health of California, all of those things. So we're either going to do it in collaboration negotiation, or if we can't get there, then we are going to pursue, these critically important public policy and community health group goals, through direct political advocacy and specifically ballot initiatives. And we can pursue improving quality, lowering cost, making California communities more healthy, doing all of those things, again, either in a negotiated, collaborative way or where we get into some very high stakes, policy and political engagements, and we would prefer to take the first route. So that's what we've said to them. As of today, they have not, we're sort of in a holding pattern. We have not heard from the leadership of the hospital industry that they're ready to go the whole way. They say there's a lot of what we presented to them that makes sense, that they like, that they feel good about, but frankly, they are just hung up on their inability to think of the union as a partner going forward. And as we've talked about before, the place where we think, we have to be prepared to go because of, our ability to organize people, our ability to, make the case publicly and in the court of public opinion for, what we think the vast majority of Californians need, which is higher quality, more affordable care and a different employment model. We've said to the industry, if by the end of October we did not have an agreement that we felt like we could take back to our members, then we were going to be prepared to go and file for title and summary with the Attorney General of the state of California and to introduce a series of potential ballot measures into the process that could ultimately lead to them being on the ballot in November of 2014. So as we talk here tonight, we are prepared and we want to incorporate this into the conversation in the program at next week's Leadership Assembly to submit the appropriate paperwork on 3 ballot measures. One of them is one that we pursued 2 years ago, which we call the Fair Pricing Act. This would, if adopted by the voters in California, this would make it illegal for hospitals to charge patients any more than 25% above the actual cost of providing care. And again, many of you will recall that the average price markup that California hospitals use when they're issuing their bills is 450% above the actual cost. It is that practice that results in the $21 aspirin, the $800 crutches, the bills that make everybody crazy when they see them. So that's the first measure. The second measure is a variation on the charity care measure that we did 2 years ago. When you boil it all down, it would essentially double the obligation of hospitals in California to provide charity care, and a new wrinkle to it is to, help properly fund the state Medi-Cal system. So, both the fair pricing and the charity care measures have multi-billion-dollar effects on the California hospital industry if ultimately they're adopted by voters. They fundamentally change the business model, and we think we can make a very strong policy case that these things absolutely are in the interest of the common good. They help to lower the cost of health care, and the way that the whole charity care obligations can be done, speaks both to cost and potentially also to quality. And then the third issue that we are prepared to file on next week is a measure that would cap the executive compensation for hospital executives at both not-for-profit and for-profit hospitals in the state of California. And if adopted by the voters, it would require that no hospital executive, not just CEOs, but executives across the board, could be paid more than the President of the United States. The President of the United States makes about $450,000 a year. It is not uncommon in California to see executives who are paid, well over $1 million a year, and some of the most prominent and highly paid executives make $3, 4, 5, 6, $8 million a year. And frankly, again, it just doesn't make sense to the public, when they see the cost of care rising, and most of the industry being ostensibly a not-for-profit, charitable institution under the laws of the state. So those are the things, that is the deadline that's looming. If we want to be able to get these on the ballot by November of 2014, we have to file for title and summary, which then, begins a process and a clock, after which we would be able to go and collect signatures, and the hard deadline, the deadline that is really the point of no return, would come in the spring of 2014, and essentially people, should think of, April 30th as the date that if we do not, accomplish our policy goals around quality, around a new paradigm, around building an industry relationship, we could pursue those goals by submitting signatures, and we essentially would have to do that by April 30th. Our expectation would be, and frankly, we've gotten a lot of communication from members of the industry, that people are, some would say there's a certain amount of denial, others would say, there are different reasons, but nobody who we have talked to believes that the process can move forward to an appropriate conclusion unless, we take the next step, and, make the two paths in the road even more clear and more concrete for people. So, that's a summary. We obviously are going to the Leadership Assembly where we want to talk about the issues and how they fit in a larger strategic context for the union. We then have an executive board meeting in December where we have to approve a budget for 2014. Depending on what happens at the Leadership Assembly, we'll then be asking the board to approve a budget that takes all of that into account and incorporates the ballot initiative work. And so we just wanted to take this opportunity in advance of, everybody being together in Sacramento next week to give people an update. The most important piece of which is we are at the point where in the next couple of weeks, if we're going to make this real and if we're going to pursue this strategy, we have to take the next step of filing title and summary. We have to begin to build a model that can be duplicated beyond hospitals for home care workers, for nursing home workers. And I should also say we're also going to be talking at the Leadership Assembly about a ballot measure that we're continuing to test in terms of polling for for its viability, and we'll have those results back by the time we get to Sacramento.